Hello from ESC Congress 2024 in London. I'm here highlighting the top trials that are going to be practice-changing in heart failure. First, to lead off, was the Fine Arts heart failure trial. This was a large-scale randomized trial of about 6,001 participants who were randomized to the non-steroidal mineralocorticoid receptor antagonist finerenone versus placebo. The trial had a median follow-up of 2.6 years, and over that period there was a significant reduction in cardiovascular death and total heart failure events. In addition, there were improvements in total heart failure events alone, as well as improvements in the Kansas City Cardiomyopathy Questionnaire, which signaled improved symptom burden. The results were entirely consistent across all clinically relevant subgroups, including patients at the highest end of the ejection fraction spectrum and patients already treated with an SGLT2 inhibitor. These data, I think, present a new therapeutic option for heart failure with mildly reduced preserved EF, a cohort that has been traditionally difficult to treat and with few medical options, and will join SGLT2 inhibitors as a definitive medical therapeutic that will improve outcomes in this population. The second trial I'd like to highlight is the HELIOS-B trial. This trial was a trial of ATTR cardiomyopathy. ATTR cardiomyopathy is a progressive form of cardiac amyloidosis in which patients face excess risks of cardiovascular death and hospitalizations. Until now, we've had few medical options to improve prognosis, namely around stabilizers of transthyretin, or TTR. HELIOS-B studied an entirely new avenue or approach to care in ATTR cardiac amyloidosis, in that this therapy is a gene stabilizer. Using RNA interference technology, this subcutaneously administered therapy allows the reduction in overall TTR levels and durably does so over time. So in the largest now outcomes trial of ATTR cardiomyopathy, HELIOS-B studied vutrisiran compared with placebo in a global cohort of patients. This trial showed that overall mortality was reduced, together with the primary endpoint of overall mortality and total cardiovascular events. This was seen in patients who were in the overall population, as well as specifically in the population called the monotherapy population, those not previously treated with the prior standard of care, tafamidis. So I think HELIOS-B data are very exciting, and I think now allows for two distinct therapeutic classes to improve prognosis in ATTR cardiac amyloidosis. The third trial that is noteworthy is the ReShape-2 trial. This was now a device therapy that was studied in patients with heart failure and moderate to severe functional mitral regurgitation. This is a field that has been somewhat controversial in that there have been two trials that preceded it that had competing or differential effects on their primary outcomes. Now ReShape-2 is presented to break the tie. This was again a large-scale global trial conducted over 9 countries in about 500 patients, and evaluated multiple primary outcomes related to cardiovascular death and hospitalizations for heart failure. These data support that TEER, or transcatheter edge-to-edge repair of the mitral valve in patients with functional MR and heart failure, do benefit from reductions in heart failure events and presents a new option as a device therapy alongside medical therapy options in this high-risk population of patients. So 3 practice-changing trials, but this is just the icing on the cake of ESC Congress. This is the global cardiology meeting, and there's a wealth of science across disciplines. So look forward to unpacking this data with everyone in the weeks and months that follow.